Hello, everybody. We will be starting the webinar in just a few moments. We're just going to wait for everybody to join the line, and then we'll begin. So I'll just give it a couple minutes here. All right, let's go ahead and begin. So thank you, everybody, for joining us today for a webinar about how to transform your healthcare contact centers with Salesforce and conversational AI into a value generator. Today I have first and foremost, my name is Daniela Levy, and I am a Senior Product Marketing Manager here at Hyro. And with me today, I have our VP Product, Pintov, who will be speaking today. And we also have a couple of guest speakers that we're really excited about having on the webinar. First and foremost, we have Dr. Sindhu Pandit, who is an industry advisor for digital health strategy at Salesforce. We just announced our new partnership with Salesforce last week, so super excited to have you here today, Dr. Pandit. We also have Lara Richardson, who is the Director of Digital Services and CRM at Intermountain Health. And also really excited to have you here to speak to what it's like from a health systems perspective. Second. Oh, I lost my mouse. There we go. Okay. So for today's agenda, I'm going to complete this short intro, and then I'm going to pass it over to Dr. Pandit to talk from the Salesforce perspective about how you can transform and automate your call center using the combination of powers here with Salesforce and conversational AI. Next, we will have Lara at Intermountain Health talk about it from the health systems perspective, talking about their personal success story using these two technologies, Salesforce and Hyro, and the amazing results that they've seen thus far. And then we will close that out with our very own Ori from Hyro, showing it all in action. So what does this conversational AI solution look like? How does Hyro integrate together with Salesforce so that you can increase your operational efficiency end-to-end while improving your patient experiences? We will have a Q&A segment at the end. Feel free to write your questions as we go. However, there is a chat section on your right side. Write your questions as they happen. Write your thoughts, write your feedback. We want it to be a little bit interactive. Feel free to, if you hear something interesting that we say, want to put your 2 cents on it, want to add in your personal experience, we would really love to see that. So feel free to communicate with each other in the chat. And we'll get to all the Q&As, to all the questions at the end during the Q&A section. And we will answer all of your questions with the full forum at that point. So before we begin, I want to dive into a quick poll for our audience. We will have a few of these polls throughout the webinar. They will pop up on your screen shortly. Do I need to stop sharing? Oh, there we go. Okay. So the first question is, are you currently using Salesforce? So just wanted to kind of get a feel for the room here. If majority of you guys are, already happy with Salesforce, looking to add AI solutions to that existing sales solution, or if you are coming to this looking at kind of it from a more holistic point of view, are you trying to see how to reestablish or reevaluate your tech stack, seeing how you can include Salesforce, seeing how you can include AI? Feel free to go ahead and answer that poll just so we kind of get an idea. It looks like about 80% so far do already use Salesforce, so 20% not using Salesforce. This is great for everybody. We will talk about kind of the unified solution across the board. So if you are not using Salesforce, this is still the webinar for you. Still stick around. I think it'll be a really informative session for both people who do and do not use Salesforce. All right, without further ado, I want to pass the mic over to Dr. Pandit.
Thank you so much, Daniela. Really, really appreciate it. And thank you all for joining today. I'm really excited about this conversation. But before we kind of dive into the solution and how it's being utilized, I kind of wanted to start with an overview of where we are. We've all been learning about evolving with the conversation around AI in general in our lives. But where are we with AI and where are we with AI in healthcare? I'm personally optimistic. I'm a practicing physician, and I've been at Salesforce for a number of years now. And I'm really optimistic about this point that we're in, with the capacity and the potential that AI offers us, and truly looking at the intelligence we can garner from all the data that we've harnessed over just, gosh, these last several decades. But we really need to be thoughtful and intentional as we approach this tool, this technology. So, I was reading an article and saw that 51% of Americans are optimistic about AI improving healthcare. That's pretty significant. That shows how much this is on the minds of people as they interact with the healthcare ecosystem. But, in another article I read, 52% of Americans are actually more concerned than excited about the increased use of artificial intelligence. And as you kind of dig into that, a lot of that has to do with transparency and trust and understanding how the technology is being used. Um, if we kind of look at the other side of that, though, the World Health Organization projects a 10 million person shortfall by 2030, which is frankly not that far away, of workers in the healthcare space. Now, that's a layered issue, as we all know, and I'm sure many of you on the call have a lot of perspective on this conversation and kind of where we stand with this. But this is a really significant issue because healthcare is personal. This affects all of us in our lives, in our families, in our communities, and this is something that we really need to be mindful of because this is a really human-oriented industry, world, ecosystem, based on where you sit in it, and it will touch us. And I think it's important that we kind of be mindful of those that are in this space right now, trying to deliver the care, trying to work in this space, and supporting them in the best way possible, and also thinking about ways we can bridge gaps that exist. If you stay on that, especially in the US, we also are, as we know, healthcare is about 20% of our GDP. And an analysis by a very large consulting firm showed that there's about $1 trillion, that's a lot of money, unrealized potential that generative AI can unlock. So we're at this interesting moment. There's a lot of challenges, a lot of headwinds that are affecting healthcare, but there's a lot of potential out there in the tools and the technologies that are frankly palpable. They're around us. They're not, futuristic. This is around us, it's happening and it's evolving fast. But let's step back and think about again that human side of healthcare specifically. As the last few decades have gone on and we've seen the data revolution, the technology sort of become baked into every aspect of how we live our lives, we've kind of developed a relationship gap in healthcare. And, I'm a PM&R doctor, which means I work in the post-acute space, but I also support a really, really vulnerable patient population. And this is really something that I feel when I'm speaking and working with those that I support. Um, it's hard to navigate the healthcare system on an individual, on a family level. There is a lot being thrown at you. There's a stat that's well known out there that as of 2020 was projected that medical knowledge was doubling every 73 days. That's a lot. And so for clinical teams to sort of stay on top of new guidelines and new innovation, that's just a lot being thrown at your clinical teams just in the clinical segment of healthcare. But think about the logistics around that, the operational element of keeping up with all of that change in these last several decades, last several years even. That's also changed and grown significantly, exponentially along the science. So when we think about kind of this gap, it's really the operational inefficiencies that sort of have become paramount, the administrative burden that's developed over time, and the lack of the ability to understand the individual you're serving as a whole person. So when we think about Salesforce in this space, um, Danielle, can we advance to the next slide? Thank you. It may not be the first name you think of when you think about healthcare technology, but we've really been helping customers in this space for over 20 years. And why is that? We're just talking about relationships. Relationships are a human interaction. When we think about relationships in our lives, when we think about those relationships we have with the clinical teams we work with, Salesforce, but really, Salesforce is synonymous with relationships. Relationships is at the core, the DNA of Salesforce. It is at the center of everything we do. We talk about it all the time. And it's really redefining what that means in this space. How can we leverage technology to up-level the way we're supporting relationships? How do we unlock that human potential in this space again? How do we get back to that human interaction using technology, using data? And now we circle back to where we are with AI. Daniela, if we could advance the slide. So if we think about where we are with data to information, but information to action, that comes back to kind of thinking, if you look back at where you work, and I don't want to assume I know, of course, all of you that are joining today, your work environments, but I took call a couple of weeks ago. There are definitely spreadsheets that are still driving a lot of our processes and a lot of our functions. Things that, if you really think about, don't need us to kind of follow those steps. It's an algorithm. So how do we think about redesigning how we're getting the work done in this element or in this moment we're standing in, with all of the data, all of the technology, and the capability to actually extract all of this information to drive action that's repetitive, that can be automated, that can be taken to scale, but that can allow for us to circle back to allow more complex issues to be surfaced to the individual that's there in their work, allowing them to kind of drive more value, unlock. I like this word, supercharge, but it's coming back to allowing people to be people in their work and giving them more satisfaction in allowing that complex nature of work that used to be what they did, be what they do now. Kind of get back to allowing automation to take place at a higher level and empowering both individuals we're serving to get what they need when they need it. But more importantly, perhaps in this conversation, allowing those that we're serving as our teammates, as our colleagues, to do better in what they're tasked to do in their environment, in their work environment. So that's all great. But there is another gap, and we can't underplay this one at all. In fact, I think we always have to have this in top of mind. This is so critical. There is a trust gap out there, and as evidenced by some of the statistics that I mentioned. And I'm sure you're thinking about this too in your own lives. Have you maybe brushed up against AI or different intelligent engines in your world? How do you think about kind of the privacy questions, bias? These are real things, and we really need to be mindful as we approach this conversation. How do we get that intelligence out of the data we're collecting, but how do we do it in a responsible way? And one thing I just want to mention here is that AI and ML and all of the things that fall under this umbrella, don't think of it and maybe as a part of your innovation team. Really, it should be baked into your operating models. And we should all be thinking of this as a way of redesigning the work we're doing in this moment that we're in. So with that, I think I'm passing it over to Daniela to ask another question.
Corey, unmute. You're unmuted?
We're good.
Oh, okay. Great. So next poll, just to kind of build off of what Dr. Pandit just said, all of these barriers that we just discussed, which is the largest concern keeping you or your organization from implementing Gen AI or AI in general? Is it a privacy issue of keeping kind of your patient's information safe? Is it hallucinations, not being able to know in advance if the AI is going to make something up, give somebody the wrong information? Is it data control, making sure that certain people are getting certain information and it's relevant to what they're looking for, and that they're not, getting old information or outdated information or information from untrusted or unreliable sources? Or is it bias and toxicity, making sure that, nobody's being discriminated against, that the AI is not giving different answers to people based on things like gender and race and all of that? So looks like the votes are coming in. So far, it looks like data control is in the lead, although hallucinations is close behind. We have 52% data control, 31% hallucinations, and 14% privacy. So, okay, very, very interesting. We'll wait for a couple more seconds. Look like final votes are trickling in, and then we'll hand it back to Dr. Pandit. All right, looks like we've got the final numbers there. Great.
Well, that is very interesting. I mean, that should tell everyone on the call that we're all thinking about this. This is all on our minds as we wade into the AI waters, if you will. At Salesforce, partnerships are so critical in how we kind of approach serving our customers, and we learn from our partners. We lean on our partners to kind of ensure that we're delivering the best that we can for our customers. And so when we think about how this partnership started with Hyro, it actually comes back to that trust gap, honestly. And there's a lot of action in this space. There are a lot of companies innovating in this space, doing a lot of work in this space that's really critical. But when you think about how do you select that partner, you have to think about your own values. How do you want to show up in this space? And who do you trust to kind of have your name beside as you wade into these waters, if you will? And that's honestly such a critical component to the foundation of this partnership that we have with Hyro. Again, as a clinician, I think about this a lot, and perhaps maybe too much per my family's commentary. But as we think about wading into this, how do we bring this into our world? I think choosing a lower risk place to start is helpful in terms of use cases, but it also, low risk is not necessarily low value. And I think that's really, really important to keep in mind. And when we talk about where can we help, it's all in the eye of the beholder. And I think we saw a huge sort of overlap in mission and in sort of approach to solving problems and issues for our customers with Hyro. They have a wonderful reputation across healthcare and those organizations they're working with. We heard over and over that operational efficiencies, driving improved outcomes, but maintaining and respecting employee experiences as well as the patient experience was top of mind. And that came through when we were discussing kind of the partnership with Hyro. But again, as we wade into this, we're learning together. And that's really a critical point to bring up. And that responsibility factor was at the center of the conversation. And so as we were thinking about places to start and supporting our customers, it was to ensure that we had tight feedback loops in place, that we ensured that, of course, we're addressing administrative burden, but making sure we aren't having any unintended consequences along the way. So what does Hyro do? Well, I am not going to profess that I'm going to give you the full end-to-end story here. That's all your age. He's coming up pretty soon here. But just as we step back and think about, Salesforce, well, Salesforce is a massive platform, and we offer a lot of support across a number of areas: collaboration, communication, automation. But where Hyro really helps us is driving operational efficiencies without compromising that patient experience, that employee experience in that front end. It's on 24/7. It allows you that seamless routing of conversations as they're coming into your call center. Because again, in healthcare, they're not all calling for parking directions and timings. They may be calling in with something pretty severe. So understanding and learning from the calls as they're coming in and ensuring that that's building a knowledge bank as you go along and that you're not losing that information as it's flowing in. That allows not just that experience to be personalized to that individual that's calling, and it not only allows for your agent to be ready for what's coming in and allow them the right information to answer the question in front of them appropriately, but now your system is learning. You're not losing that information. And so as we sit here today in 2023, this information can drive how you're thinking about next year and the year after that, and continuing to evolve as that data comes in. And I think that is the most important secret sauce, if you will, is that you almost have another, you have an operational team member in a tool like this. So with that, I think I am bringing on Daniela again, or
yeah, I'll just
passing over to her. Okay. Well, thank you so much, all. I appreciate the time. And Daniela, I'll hand it back over to you.
Great. Thank you, Dr. Pandit. That was incredible. I don't know that maybe Ori could have said it even better himself. So thank you so much for kind of explaining that and setting the scene here for Lara from Intermountain Health to present her success story. Intermountain has implemented with Salesforce and Hyro together, and they've done an incredible job. They're kind of a star client for us. We love working with them, and very excited to hear from Lara about the implementation they've done here.
Great. Thanks so much, Daniela, and thanks for giving us some time to talk about our journey. So just a little bit about Intermountain. We're in 7 states across the Intermountain West and have over 70,000 caregivers. And caregivers is the holistic name that we have for our providers, our nurses, our support staff. And that's really all because we're all part of the patient care. Our vision and our mission is to help the people live their healthiest lives possible. So for the next slide, just wanted to give you a little bit of a look of how we're organized. And we have 3 care regions. So our peaks, our desert, and our canyons area, as well as an insurance arm, Select Health. And this is just a sampling of the dozens of contact centers we have across our organization. Many of them have come out of the unique needs of our departments and business units. And to be honest, they're not always focused on that patient experience. So we decided to embark on a multi-year journey to really reimagine this overall experience. And so what we found here is, again, that looking at our operations, we were really focused on patients calling us when it's convenient for us. And so we wanted to make sure that when they had to do things like booking appointments, refilling prescriptions, getting questions answered, that they had a number to call. But unfortunately, some of the time when our patients were calling, they had to wait on hold for a long time. And if we look at the caregivers' experience, it wasn't much better. So they were spending a significant amount of time swivel chairing between different tools and technologies to try to help the patient. But it wasn't very efficient. And honestly, they didn't have the opportunity to really sit and listen and understand what the patient is calling about. So as part of this work too, we not only looked at what we had, but also what other industries had done in this area. And we saw that a lot of them had made self-service really simple and easy. For instance, at the grocery store, you can now check out on your own. Airlines give you the ability to be able to check your own bags in. And so we knew that we'd be able to bring some of these innovations into healthcare as well. So at the end of the day, we want to make sure that we're offering our consumers an excellent consumer experience and having it personalized as well. So we decided to invest in a best-in-class tech stack, standardize our processes across our contact centers, and then also look at redesigning how we interact with our patients. So as we were looking at this, some of the values that we really had focused both on our consumers as well as our agents. And the big thing that we had is we wanted to make sure that for those people that were calling, we had a much better call experience than what we'd had in the past. So we wanted patients to be able to say what they're trying to do rather than having to kind of fit their needs into a predefined IVR. We also wanted our patients to be able to self-service on simple things like maybe getting clinic information, parking directions, information on their upcoming appointment that you probably don't want to wait on hold for 5 minutes to get. And then finally, we also wanted to make sure that we started adding in additional channels. We know that there's a lot of people, myself included, that don't want to talk to somebody on the phone. I want to be able to do it on my own. And so we wanted to be able to have the ability to chat with somebody, maybe even text in, email, and have more of that 24/7 support. And then finally, we wanted to make sure that when a patient needs or wants to talk to a real person, that we get them to the right place on the first time. So for our agents, it was all about simplifying the work that they're doing. And we centralized the tools that they have. We added automation to simplify that work and also made sure that we had a better case management system. So if a patient was calling in and we couldn't solve that problem on that first interaction, we had a way to track that issue and make sure that it was resolved by the right people. So as I had mentioned, we decided to build a tech stack kind of out of the ground. We did a deep evaluation of many vendors and partners out there. And we ultimately decided on using Genesis for our telephony and workforce management tools, Salesforce for our agent desktop, Hyro for our conversational AI across all of our channels, and then Qualtrics to really help us understand the overall patient experience. So kind of digging in a little bit more into what we built on Salesforce and our centralized dashboards, we wanted to make sure that agents had all of their tools in one place. So when that phone rings or they get a live chat, they know who it is, what they're calling about or contacting us about, and that they have all of the tools that they need about that specific clinic, about that specific need, so that they're ready to go. We also wanted a way to have consistency across our channels, and that's really where Hyro came in. So we wanted to make sure, again, if our patients wanted to chat with us, they wanted to call us, and they asked questions, that they were going to get consistent answers between all of them. Okay, so let's move on to the results. We're really excited about the impact that we've been able to have for some of our contact centers in a pretty short amount of time. So first off is those call routes. We were able to have 91% of our calls successfully routed. So, you know, for anyone that's worked with an IVR, a lot of times you get bounced around. You might have to start over, or me, I have to call back and just start over completely. And it's really frustrating. So it's really great to have our patients be able to actually talk naturally and say exactly what they're looking to accomplish. And we're really excited to know that kind of 9 out of 10 times we're able to get them to the right place on that first shot. Now, with our chatbot, we've seen that we've had 79% of those goals completed, and patients really getting what they want out of the chat. So again, this has been really, really helpful for us because we've been able to allow patients to get the information they need or the issues resolved, and that's happening 24/7. I think the two things that we're really excited about is being able to lower that call abandonment rate as well as our speed to answer. So we've actually been able to reduce the amount of calls that are hanging up by 64%, as well as answer those calls 27% more often. And one of the things that makes it really important for us our call abandonment rate is this example. So when a patient first calls and we don't answer the call, one of the things that they'll do is probably just call us back. But that's put the burden on the patient. We're taking their time and energy to actually connect with us again. But during that time, there's a chance that they say, this is too hard. This is too much of a hassle. There's a different provider and a different organization that can meet my needs better. And so if that happens, we've ended up losing that patient from our entire healthcare system. And then on the far side, the worst case scenario is that patient just decides not to get care, and they could end up in the ER, which obviously is the worst outcome for them and is also expensive for us as a healthcare system. So we're really excited that we've been able to answer those calls in a timely manner, much more effectively. So one of the other things that I wanted to just touch on is the team that we've worked with for this project. And, I'll use the term, it takes a village, and it really does on something like this. So we've taken multiple experts across different groups to really help us build out our next generation contact center. And it's been a partnership from technology, consumer experience, and operations from the very beginning. But quickly we brought in our partners in finance, cybersecurity, privacy, and even our contact center agents to make sure that what we're building is something safe, sustainable, and scalable across our entire organization. If you want to move to the next slide, I'll start showing you all a few of the great data points that we've had and really the way that we've been able to understand what our patients want even more as we've built out this contact center tech stack. So this first one is a overview of when our patients are interacting with our conversational AI. And so you'll see in kind of the blue area, a lot of them are coming in during the lunchtime hour. So you've got a break in between meetings, call in to get a question answered, an appointment scheduled. But one of the interesting things that we saw here is that 27% of those interactions are happening off hours. So it really gave us that insight that we need to make sure that we've got a really well built out chatbot, places that people can self-serve over the phone and off hours, and potentially even start staffing live agents in those times when we haven't traditionally had our call centers open. Going to the next one, this is where we can see why patients are calling in. So again, this is a great place where we've been able to get more rich data than what we had when we were using a traditional IVR. You'll see at the top that our number one thing is that people want to talk to a live agent. And that's perfectly okay. We want to be able to get them to talk to a live person if that's what they're looking for. But we know that a lot of people would like to be able to just get stuff done even quicker and faster and maybe on their own. And so we can really see here the breakdown of the amount of appointments that are being scheduled, the people that are requesting information about their prescription refills, and be able to help make sure that we've got an operational plan. This one here is going to show us more details about the actual specialties that are being searched. And then I'll move to my final one, which is really exciting for us. And this is the frequently asked questions. So you'll see at the top, we still haven't kind of figured out the whole password reset piece. It's still a challenge for many people. But this is a way that we've been able to kind of, again, uncover those places where we've found some opportunities to improve. And one of the ones I really like to talk about is that we found in this that we had a tremendous amount of calls coming in for clinic fax numbers. I didn't even know that we had faxes anymore, but we had a bunch of people that needed to be able to fax in information. And what we did is we built out an automation for that. So we were able to help people simply understand what the fax number was for the clinic they're calling. We could text it to them, and it helped them be able to get the information they needed quickly and efficiently, as well as freeing up the time of our live agents to work on those more complex cases. So with my final couple minutes, the things that I wanted to talk about are some of the lessons learned that we've had here. And there, I don't think there's anything groundbreaking here, but we've been really excited about just the partnership that we've been able to have. And it really is making sure that you have that cross-functional team coming to the table and helping you understand all of the handoffs, all of the challenges that you might encounter. And then, of course, having a leadership team that's really there to support you, to be able to help remove those barriers is just invaluable. One of the things that we constantly reminded ourselves is that a lot of this hasn't been done in healthcare before or at this scale. And so we wanted to make sure that we reminded ourselves that this is hard, but big things like that are just done one step at a time. We also wanted to make sure that we were moving quickly and pivoting when things didn't work. And then also making sure that we were being pragmatic rather than, waiting for things to be perfect. I think one of the final things that we found was really helpful was celebrating those little wins along the way. On a big journey like this, it's going to take us multiple years to get to the finish line, if we ever do. And so being able to stop and just be able to really celebrate the things that we've done well just makes a world of difference. I think the final thing I'll say is there's always ways to improve, and some of the things that we looked at were just better communicating and collaborating with our partners. So with that, I will pass it on to you, Daniela, for a poll.
Thank you very much, Lara. That was amazing. Love seeing kind of the results that Intermountain Health is experiencing, and to hear kind of the true story of what it really looks like on the field and on the ground. I think a lot of people talk about generative AI and AI in general as kind of this theoretical thing, and to see actually how you guys are implementing it is really inspiring. So we're going to jump into another poll here before we move into our Hyro segment. Okay, so this one is a question to our audience about is implementing Gen AI into your patient-facing workflows specifically on your roadmap for 2024? Yes, if it's within the next 6 months, if it's planned for maybe the second half of 2024, if it's not on your agenda at all yet, but you're kind of just having a look around, trying to get yourself informed to see how other people are doing it. Or, if you are another trailblazer and you've already implemented a solution and maybe you're not happy with it, maybe you are happy with it. So just go ahead and I'll wait for the polls to come in here. It looks like the majority, 55% or 50%, are saying that they're planning to implement within the next 6 months. Another 40% saying in the next second half of next year. So it looks like in the next year, we have a majority of the people on the line looking to implement Gen AI into their patient-facing workflows, which is really quite impressive. So it seems like we have a lot of forward-thinking, innovative people on the line here today, which is amazing. We love having you. You definitely are people. We're looking forward to kind of showing you here now what the Hyro solution is. So we'll end the poll now, and I'm going to go ahead and hand over the screen to our presenter, Uri, who is really going to do a dive into what the Hyro solution looks like with Salesforce end-to-end, how that patient journey flows together from the very beginning of an inquiry to getting it passed over to the agent and improving that agent efficiency. I will hand it over to you now, Uri.
Thanks very much, Daniela. And Lara, amazing to hear the story. So just backing up, what is Hyro all about? AI assistants for Salesforce. We're really, the AI assistants, they sit on web chat, voice, and mobile, and they really need no training. So they're really as accurate as your data, public websites, PDFs, and now even Salesforce knowledge articles. And with our new app on the App Exchange, they plug in seamlessly to Service Cloud, Health Cloud, and Experience Cloud. So I'm happy to dive in and talk a little bit about what it looks like. Before I do, though, think of Hyro as your first line of defense, both on web chat and on voice. And especially on voice, we come in and replace part or the entire IVR system. We're able to do deflection and answer questions, as you heard, and appointment management, one of the top cases, and we're able to smartly route to the right person when that's needed. And we're doing that with integration and open CTI integration, obviously. But now with our new package, we also support Service Cloud Voice, and this is a big deal. Whether you're using Amazon Connect telephony or whether you're using Salesforce's BYOT, bring your own telephony, powered by Genesys, Avaya, and other telephony providers, we're able to pass back the call to the telephony provider. But whether we completely deflect the call and, as Lara mentioned, goal completion, achieve the goal for the patient or member, or we have to transfer to for additional care, we will record in Salesforce what happened in the AI conversation, and not just a summary of the transcript, obviously, but the events. Was an appointment created? Was the MyChart password reset? And so the agent, once they are speaking with the patient or the member, they have the context. So let's look at what it looks like, and definitely call to action is go into the App Exchange, download. You can download our new app into your production, sandbox, and developer org, and it's really easy to set up. So I'm going to get out of presentation mode here, and once you have installed it on your org, quickly go into.
We can't see your screen.
Let me share. Okay, hopefully that's better.
Perfect.
Once you've downloaded the app, it's really easy to set up. You hit the Hyro app, and it really comes with the easy to follow admin setup experience. You basically have a connected app, and it's fully secure, and all the communication between the Hyro web and voice assistants are now connected to your Salesforce org. And after setting up permissions and configuring it, all you have to do is set up the assistants and activate them. It comes with a prepared demo app, so play with it and get familiar with it, really to build trust with the AI. And just to show you a little bit of what that looks like, once you're configuring your web assistant, then really you're configuring the skills that plug in things like finding a provider, doing appointment management, finding the right location. All the chats are obviously recorded here. And for voice, those would typically be things like, were we able to achieve appointment verification, reset password. So let's jump into a live demonstration here. I'm going to go ahead and stop sharing this. And let's see if we can have a real call with an AI assistant.
Hello, I'm Intermountain Health's virtual assistant. I can help with appointments and referrals, prescriptions and test results, resetting your MyChart credentials, and more. What are you calling about today?
Hi, I'd like to verify my appointment, please.
To confirm, you are looking for hearing upcoming appointment details. Is that correct?
Yes, please.
For identification purposes, we need to verify a few details. What is the patient's date of birth?
January 1st, 1980.
The patient's date of birth is January 1st, 1980. Is that correct?
Yes.
Before reading you the details of the upcoming appointments, would you like to receive this information also in a text message?
No.
Okay, you have one upcoming appointment. The upcoming appointment is office visit with Dr. Susan Bloss on Monday, May 20th, 2024 at 8:15 a.m. The address is 123 Test Street, Wisconsin, 53590. Do you want to hear the details of this appointment again before we continue?
No.
Okay, you've heard all appointments. Is there anything else I can help you with? If not, feel free to hang up.
Yes, I forgot the password for my chart.
To confirm, you are looking for help resetting your username or password. Is that correct?
Yes.
I can help you to reset your username and password. May I text you the link you need?
Yes, please.
Should I send the message to the number you are currently calling from?
Yes.
Got it. I've just sent you the link that contains everything you need. Thanks for calling, and have a nice day.
Okay, that was pretty cool. I got the message on my watch, but it's here as well. And really deflecting some of these super valuable for some of our customers, just taking you to the right place so that you're able to quickly reset your password and continue the conversation. I'm going to stop sharing this and kind of take you behind the scenes a little bit. Okay, so let's start a new conversation here. Just one sec. Just put myself online. Just one moment, please. Okay. So let's start with something like, I hurt my arm. What should I put on my wound? And as I said, there's no training here. Really, where we're answering from, and this is our explainability layer. Each and every answer that comes back, we can explain the source of the answer. And that's really important when you use AI and generative AI. You know, we would never put the patient, sending messages directly to any LLM or directly to OpenAI. You know, Hyro's explainability and control layer is really what makes this magic work. So I can go ahead and say, do you offer MRI scans? And some of the links that, some of these websites are huge and there's so much data in it. I think here's an example of how we're able to kind of pinpoint the person who's asking the question to the exact service, the correct number that they need in order to achieve their goal and learn more. But some of the users are also saying things like, can you recommend a doctor for that? And one of the things to notice here is multi-turn, is the ability for the AI assistant to, what do you mean for that? It's not based on the last thing I said, but maybe things that I said in the beginning of the conversation. And much like ChatGPT, Hyro's AI assistants interact with the full context of the conversation. And so from here, we can do many things. We can call the provider. Some of our customers even let you book online directly from the web chat experience. In this case, I'll say I prefer a female doctor. And again, really helping you to find the right provider. You can, from here, even just get to the right page and complete the booking experience from here. Also for existing established patients, but also, providers that accept new patients. We support via integration, open scheduling and direct scheduling. And so it's not a huge project to connect. Hyro's skills come predefined with those APIs in place. But let's say I have some additional questions, and I'll go ahead and say chat with an agent. I want to ask specifically about the MRI scan. And this is where we are transferring the chat to Salesforce's live chat. But of course, we want to save time for the agent, and we're going to do identification of the patient or member. So I'm going to say, my name is Armand Knight. Just fill in my password here. And that saves a lot of time. So when you're finally coming in to the chat queue, the voice really saves a lot of time. And putting my caregiver on, as Lara said here, or CSR, I'm servicing the chat queue, and I see a chat coming in, and I see the information coming from Hyro's web assistant, and I can click on it, and of course, transcription is all available, and we can look at the entire conversation with the AI assistant, and of course, we can say things like, "Hi, how can I help you?" You can see that now the person knows they're interacting with a human being and not an AI assistant. We can say things like, do I need to prep for an MRI scan? And as you know, Salesforce is super powerful at being able to do the patient engagement in context, personalized, because all the information is really saved in Salesforce. We can use things like a quick text, because many of our patients or members ask this question and really reply so quickly with a quick text. And we can add somebody to the conversation and transfer to the right place from here. So why don't I stop the chat here, because I want to show you a few other things that happen behind the scenes. Based on the information that Hyro sends to Salesforce, you can automate a lot. And you can automate using flows, omni flows, things like look up if a case already exists, add to it, open a new case, of course, patient identification, but also some other things. So let's go into this case here and look at our patient, Armand Knight. And here, we have the full 360-degree view of the patient. You can see that in the feed of the case, this patient had an interaction with Hyro's chat. And if we click on that, this is part of our package, is capturing the essence, what happened in the chat conversation, what goals did we complete for this patient, was the patient verified, in the verification data, encrypted, of course, was the chat transferred, and if we used any knowledge from Salesforce, in this case, a knowledge article about wound care. And what's amazing about this is that you don't have to exactly ask it like it's written in the knowledge article. The AI assistant understands that by itself. We summarize what happened with something we call goal completions, as Lara alluded to. Were we able to achieve the goals that the patient was asking for? And in this case, we were able to find the right provider and also answer a general question. I'd like to show one other thing about voice. So we have summary conversations from chat, but also from voice. And so also for these conversations, you can link them to the case and see if the patient was verified, transferred to an agent, and a summary. I'd like to show you some of the goals completed here. For example, appointment verification and resetting the password, which we saw as a demo in our voice overview. So I think with that, I'll stop here and maybe open it up to some questions.
Great. Amazing. Thank you so much, Ori, for that amazing live demo. Really amazing to see the joint Salesforce and Hyro solution in action, both across, calling from the voice side, but also on the website as well for omni-channel AI support. We're going to dive into the Q&A now. Before we do, I'm going to do one more poll. I'm going to pop that up on the screen right here in a second. While the poll is pulling up and while we're answering that final poll, go ahead and start writing any of your questions into the chat into the chat box, and we will answer any questions soon. The poll up here just asking if you'd like to see a personalized demo of how the Hyro and Salesforce solution can work specifically for you with your integrations, with your telephony system, the specific kinds of use cases that you'd like to see, whether it's scheduling or fax resolution using a GPT-powered search. We are happy to do custom demos for you guys, really showing the ROI for your specific organization, mapping out kind of how we can help and what the results will look like for you. Alrighty, so I think that's it for the polls. Let's have a look. I think we had some questions here in the chat earlier on. So let me scroll back a little bit and see what we've got. We had somebody ask if there's going to be a recording available. Yes, we will send this out to all attendees and to registrants. So don't worry, that will be in your inbox soon. Somebody asked, can you please talk a little bit more about the comprehensive patient 360? What touch points are all being captured? And does this include patient contacts online or directly with the physician office by passing the contact centers?
What a question.
Yes, that is.
Maybe Lara should take that one.
Yeah, I can talk a little bit about how we've built our patient 360, and it's a journey. So to start out, what we've done is we've brought in all of this core demographics about our patients, as well as information about both past and upcoming appointments, prescription refills, encounters that they've had with us in offices, so that when the agent is talking to somebody, whether it's live chat or on the phone, they really start getting that empathy for where that patient is and what they're experiencing. We are bringing in all of our calls so that we can see things like, maybe Daniela's called us 5 times in the last 3 weeks. And so we know that she's really going to need some extra kind of love and attention and make sure that we get it right. Some of the things that we're really excited to start bringing in is more of our sentiment and consumer feedback. So really understanding how our patients feel about their experiences with us, and if it's been easy to work with us or if it's been a hassle. So again, we can start really empathizing with where they are in their journey and helping them better.
Amazing. Thanks, Lara. We have another question here that says, was this MyChart epic? I'm not sure exactly what point this was, but I think, Ori, maybe you can touch on epic and maybe MyChart in regards to the password reset.
Yeah, I can generally say that, yes, our skills within the AI assistant integrate seamlessly to Epic and Cerner, and it doesn't take a full-blown project to make that work. And so, yes, the reset password skill that you saw in action actually does that directly with MyChart.
I think this next question will also be for you, Ori. How do you track reliability and validity of information? And how do you get feedback from end users about their experience? Wow,
this is an amazing question. I think you saw a little bit of that in Lara's presentation with the analytics. I think one of the powers of Hyro is to open up the eyes of everyone in the organization, what patients are asking for and how well we're doing. And we call it knowledge optimization. Basically, when you start, the AI assistant basically has the data and it answers as accurately as it is on your website or in the Salesforce knowledge article. And very quickly, you find the knowledge gaps. You find what people are asking about that you don't have information about. And we work, our customer success team works really closely with customers like Intermountain to make that better. And we make that better in various ways. But one of them is producing more up-to-date, relevant knowledge articles, PDFs, and updating the website. And there's no retraining, so that it seamlessly every day grabs the new information. And you can also block information, so you don't have to give it. It's actually recommended not to give it the entire website. Things like testimonials that are very private for people are not really relevant for the AI assistant to answer questions with. So if you as we progress with our customers, you become much more accurate about the way that you're answering the questions. Yeah.
Great. Looks like we are at the end of time. We're right at the hour. Just want to say a quick thank you so much to all of our incredible speakers. You guys all brought such amazing, I think, points of view to the conversation, from Dr. Pandit, from like your experience as a clinician, Lara, from the health system side, like really just being there on the ground, implementing these solutions, and Ori, of course, our wonderful product manager, bringing these solutions to life together with the help of the Salesforce team. Just wanted to thank all of you guys for being here today and talking about your experiences. And thank you so much to our audience for spending the time being here with us today. Look out for your inboxes for the recording of this webinar to send internally if you want to share. Yeah, everybody, I hope you have a good rest of your day.
Thank you so much.